That Don't Sound Right is a podcast about talking the way we did before the internet, when you could not prove anyone right or wrong.
All the expertise was contained in the people involved with the conversation. I'm Peter.
I'm Cecil, and I hope you enjoy our conversations. And as you listen, if you find yourself silently saying, that don't sound right, send us a comment. You're one of us.
Why are you scared? Why is that scary?
Everybody's laughed at me for this. So then after I did that, I asked AI where my pocket knife was.
Yeah?
Because I lost my pocket knife.
Oh, did they find it? Welcome back to another episode of That Don't Sound Right, a podcast about talking. We're your co-hosts. I'm Peter Pillman.
I'm Cecil Davis.
And we're just trying to have a conversation without Googling or fact-checking each other. Those things can so easily kill the conversation.
And we don't want to kill the conversation.
Have you killed the conversation recently?
Not recently. I have done some Googling, and people have accused me of killing the conversation, but to my defense, I thought it was pretty cut and dry. I think we had made it to the Google point. So I didn't think I was killing the conversation, but maybe I'm wrong.
I had a comment.
Maybe I've become self-righteous.
Well, maybe so. I certainly have. But I've got a comment not just the other day where we were talking and someone immediately got out their phone and started Googling it, and they paused and looked up at me, and they I can't remember if they apologized or they said they were just very sincere in saying, yeah, this is just not what you do, Peter. I understand. but I mean, and we had to figure out the answer to this. I mean, there's only so many tennis player names I can come up with at the U.S. Open. And because we were talking about the tennis player from Hyattsville, Maryland. Have you heard about this guy?
I have not.
Yeah. So he lost in the semifinal, but he was from Hyattsville, Maryland. And that's where my brother lives right now. Cool. But anyway, we were looking at the phone, and that's become a brand of ours. You and me.
Yeah.
That we are the don't Google it until you absolutely have to.
There's a podcast I listen to that's specifically about Googling.
Okay. On how to do it?
Well, no, it's just they will pick a topic each week just like we do.
Yeah.
But instead of talking about it, they Google it.
They just Google it.
They keep like rabbit trailing and see how far they can go.
How many listeners do they have?
I've not looked.
I bet you they have more than we do.
They probably have.
It's much more interesting to keep going down those rabbit trails, because our rabbit holes are very shallow.
That's right, because they end with us. So, as we've said many times on this show, I am a pharmacist, and I have said something that many people have told me that don't sound right about my own profession.
Okay.
So almost since I have started in pharmacy, which has been 32 years now.
Congratulations.
Thanks.
That's a long run.
That's surprising they licensed me that many times.
It's a good run, Cecil.
It's been a good run. Not that I'm getting ready to retire, in case anybody from my work's listening. So from almost very beginning of my career, I've said that pharmacy, in my opinion, is a dying profession.
Dying profession, as in...
I know my accent may get in there a little bit.
Yeah,
dying.
But as in... You're saying that having a job as a pharmacist is... We're going to need less and less and almost never need them again?
Well, I think the profession is dying out. Yes, so to your point, yes, to some degree. Now, this is a very nuanced subject, and there are lots of people, if they heard this, would say that I'm crazy, and it fluctuates. But here's what I'm thinking.
Okay.
If you think about the history of pharmacy as it evolved over time, really it initially evolved into a person who was concocting or mixing or making medicines that a physician ordered.
Right.
So like I have an old pharmacopoeia book.
Ooh, what is that?
It's just a book of recipes.
Really?
Or formulas for pharmaceuticals.
Oh, man.
And I forget how old it is. And so this was a book that they would keep in the pharmacy. And the doctor, you would have an ailment.
Right.
And he would write.
I have a running nose right now.
Right. And so the doctor would write for whatever, and you would bring it to the pharmacist, and the pharmacist would have this book of recipes that they would make some concoction for you to take.
Right.
And so I used to work in an older pharmacy that had an area of all these old, just powdered ingredients that used to be made into these remedies.
Right.
And so now a lot of these stuff was snake oil, and to some degree. I mean, it had some pharmaceutical value. A lot of it probably was just symptomatic relief. You weren't curing all.
But I guess that's my question: is that did the doctor have I guess the doctor would have a wide knowledge of the different compounds that would make somebody feel better or cure something.
Yep.
And were they depending on the pharmacist to know like the proportions and how to put the stuff together? Or would they even say, no, I want you to mix 2 parts of ibuprofen with 1 part of acetylene and 1 part of honey, mix it in a slurry so they can take it by spoon. They want them to take it 2 teaspoons every night. Is that what they would do?
Yeah, it was a little bit of both. Like, so sometimes the doctor would write out exactly what they wanted in the whatever the concoction was. But sometimes they would say, make a concoction of tincture of iodine or something, and the pharmacist would have a recipe that they would use. So it'd go back and forth. This is a big, thick book just of recipes for all kinds of ailments.
So if
rheumatism and consumption and fainting spells, all have all these different little.
But if the doctor didn't specify how much of each ingredient to put in, you could get a varied result depending on the pharmacist in which pharmapedia. What's it called again?
It's a pharmacopoeia.
Pharmacopoeia. Which pharmacopoeia? It depends on which edition they had, right?
Yeah, what they had, or if they had one, or depending on what kind of pharmacist you got. Because pre-licensing days, this is the whole reason we have federal regulations on how medications are made, and sold,
right?
And so that's why we had certain like the Food, Drug, and Cosmetic Act that was created to kind of get rid of what they used to call snake oils, all these concoctions, and move to a more standardized medications. Okay. So that's all history. So normally, doctor writes it, pharmacist makes it.
Right.
And so there's this kind of skill set to it. But as we moved into the modern era, right, you started having medications that were pre-made or manufactured by pharmaceutical companies.
Right. They're putting the compounds together.
And we started getting better medication and medications that really treated the underlying disease state.
Yeah.
Okay. But then, so the pharmacist's job of compounding, which again, I know where you're standing, there's going to be some nuance to this. They're still compounding pharmacies. But primarily, the pharmacist's job began to shift, at least in retail, to where they were, instead of making medications, they were now counting medications out of a bottle and putting them in another bottle and putting a label on that and giving it to a patient.
Right. But I mean, they were also the conduit, right? They were the licensed person to receive these very special medications.
Yes.
They would know the names of them. I would also think that a pharmacist would also know the patient's history somewhat to say, hey, this patient's taking this medication, and I know as a pharmacist, these two interact. We probably shouldn't do that. I mean, you're kind of a final check on the doctor in the event the doctor makes a mistake.
Yes, and this is what's bringing me to my point. Okay, so initially, all this was done.
I'm trying to save your job.
I know you are. Initially, all this was kind of done in your head. You knew your customers.
Yeah.
You knew what they were because we didn't have computers.
Right.
You had to know what they were.
Yeah, that.
And you have to remember.
Or you could look in your pharmacopoeia, right?
Right. But like if you were on 3 medications or 4 medications, they were on these squares of paper that were filed separately in different parts of the pharmacy, different boxes in the pharmacy.
It could have been different pharmacies.
Or different pharmacies. And so unless you knew that this lady or this man was on these 4 or 5 medications, or you asked, all this was done in your head.
Now, generally, doctors do ask you, what medications are you on?
Right.
So that's their first check.
Yeah, but now it's all done on a computer. Like if you're getting everything at one pharmacy, they know everything you're on. And the computer checks for interactions.
Yeah.
Okay. But as you can see, the pharmacy is beginning to evolve. It's moved from making medications to distributing medications. And like you said, there's a component to it where the pharmacist is that final check, right?
Right.
But here's my point. And again, this is for one particular thing. You have by regulation that a pharmacist has to dispense a medication. I mean, that's why, there's laws written that says, the doctor writes the prescription, it comes to a pharmacist. The pharmacist is licensed to dispense that medication.
Yeah.
In most cases, the physician is also licensed to dispense that medication.
Oh, they had it.
They have to keep the same records as a pharmacist does, but they have to dispense them. But here's my point.
If they had it in their office.
Yeah, if they had it in their office.
Okay.
But it's just a regulation change to make that go away. All of a sudden you could, and I think this is what will eventually happen in pharmacy, take the distribution part and make it where it's not regulated, where a pharmacist has to go through it. If a physician wants a particular medication, they write for that medication, and then it is distributed to the end user without a pharmacist being involved in the distribution piece. Now, I think where people are going to argue is there's always a clinical reason, just like you're saying, where the pharmacist needs to be there to review certain things and make sure that what's been prescribed is not counteracting other things.
Right.
But eventually, I think even that piece, as you can imagine, AI might start to be kind of creep in on that piece.
Right. So I guess in your world of no pharmacists, the doctor has all the medications in their office.
No, I'm saying that there would be a way to distribute the medications, either, and it could still be a pharmacy. It just won't be manned by pharmacists.
Right.
Because it would be primarily robotically done.
Oh, okay. It could be It could be robotically, or it just could be a technician who's trained into reading what the medication is, getting the right one out, putting it together, and putting a label on it.
Yeah. I had a professor, and he would say this all the time. And again, he would say 99% of the time what the pharmacist is doing could be done by a monkey that was trained.
Okay.
But you really need the pharmacist, that 1%. And he was saying it like as a pep talk. That, you guys are really there for that 1% of the time. Well, if you take what he's saying seriously, then why wouldn't you automate the 99%?
Right.
And then really let the pharmacist potentially concentrate on the 1%.
Right.
Right. Because
if it's just 1%, there's a lot less pharmacists needed.
If there's just 1%, there's a lot less pharmacists. And now this guy was saying this, again, 32 years ago. And again, he was trying to be funny. He was making it, he was trying to make a pep talk saying, hey, we really need you this particular time. The same thing said about the airline industry now, that in the future, and we've made this joke on the air before, that airplanes will have the pilot and a dog. And the dog is in the cockpit to make sure the pilot doesn't touch any of the controls.
No, I don't think we've talked about this one, yeah.
It's the same sort of contact. It was like you don't want somebody interfering with a very automated process because there's more likely to mess it up than they are to make it correct. Now, again, pilots are going to argue with that, saying there's airmanship, and I think that's been proven. Pharmacists are going to argue with me about this. But there's a segment, the distribution segment, that I think can be fully automated at some point.
What about how does this? So you're thinking about the pharmacy industry here in the United States.
Yeah.
How is it regulated and controlled in other countries?
That's a good question. I don't have a good answer to that. It would probably be similar in most countries. It'd probably be very similar.
Do you feel like we have less access to medications because we have to go through a pharmacy here, that there's more over the counter in other countries? That's the impression I get.
Yeah,
there's more over the counter, that I guess there's more. I mean, you don't even need a doctor to get some of these things. You just go get it over the counter.
Yeah.
Is that
That's been my experience when I've traveled.
Okay.
Especially in China.
Why do you think that is?
I think in America, we tend to be very safety conscious.
Mm-hmm.
And so we want things to be very safe. And so we have these laws in place to make sure. So, I think that's why we have more restrictive, or it may be for money. I don't know. Maybe there's a money motive behind it somewhere. But yeah, like in China, I was amazed at what you could get over the counter in a pharmacy. How
much of pharmacy school is chemistry?
When I graduated, I had enough. That's a baited question for you, since evidently I can remember none of my chemistry.
But I got a follow-up question to that.
Yeah, I think when I graduated, I had enough chemistry, or was there a few credits to have a major in chemistry.
Okay, yeah. So I guess a pharmacist still the role for another role for a pharmacist. Mm-hmm. Is in the pharmaceutical industry, still putting these compounds together, still developing, still experimenting, still brainstorming, being creative to find new ways to help us.
Yes, but those degrees tend to be pure science degrees. Like you're going to get a degree in pharmaceutical chemistry.
Is that what that's
or
called?
Molecular chemistry.
Okay.
Or you're going to have degrees that are specific for drug development, because the pharmacy degree is really to prepare you to be licensed to practice.
Okay.
And like even as far back in my grandfather's life in North Carolina, he could have sat because he worked in a pharmacy. He wasn't a pharmacist. Because he worked in a pharmacy and assisted a pharmacist, he could have sat for the board and become a licensed pharmacist
Without ever
even been
because he had that experience.
because he had the experience.
I got
He could have apprenticed in at one point.
Okay.
And so the degree is, the profession and the degree has progressed over time. But now you have these degrees that are, maybe heavy in chemistry, but on a day-to-day basis, I'm not, as I have very aptly demonstrated in this podcast, not using my chemistry to dispense medications.
I guess one thing that comes to mind is I don't know how popular it is, but it seems to come and go, of the herbal remedies.
Yeah.
Just all natural remedies.
Yeah.
My wife and I, we watched several different survival TV shows.
Yeah.
One's called Alone.
Yeah, I watched
And
that too.
some of these men and women that go on the show have a really deep background in herbal remedies and knowing how to find herbs and plants to help with indigestion, help with infections.
Yeah.
It's something like as serious as an infection.
Yeah.
How to do burns.
Right.
I'm a little surprised that pharmacists don't have a greater role in that today and are providing that service
I think
more readily.
Yeah, I think in retail, there are a lot of questions that come up like that. And I've had friends that have had purely herbal pharmacies where that's all they dispense. They didn't dispense.
Oh, you had friends as pharmacists that were herbal
Now,
pharmacists.
they didn't have to be licensed as a pharmacist to do this, but they opened shops that, specifically, and there's a store in Kernersville that specifically works on, non-traditional medications. And the person that owns it and runs it's not a pharmacist, but, they're available. And when I go in there to get stuff, she knows I'm a pharmacist, and we have a good conversation.
See, I think when there's complete social chaos and breakdown, you're going to be fine.
I can pull out my recipe book.
Pull out the pharmacopedia.
Yeah.
But no, even go back to the home remedies, the natural remedies, the herbs, the spices that are out there, and bring those back, man. Prove that those work.
Some of that works. It just doesn't work as well, in my opinion.
But
patent medication.
I'm just saying, when there's complete social breakdown, when you can't get the medicine that you need, you've got something. I've always thought whiskey is currency. Moonshine will be currency.
Yeah.
I think your ability to help people with their pains, infections, indigestion.
You might be right, man.
Just things that we won't be able to get medicine for, you're going to have something that we're going to need. Yeah. You're going to be, your cabin's going to be flowing with bourbon, man.
You're trying to save my job again. And another reason we moved away from all these things is some of them were horribly, horribly bad things.
Well, yes.
So like creosote, which as you know, is used to preserve telephone poles.
Yeah, was
used as a cough medication. In cough medication.
Oh, man.
So I think even I think Creemulsion, I think the name came from, because somewhere way in the bag it had creosote in it.
Oh.
So turpentine was used, which again is
bad
not
stuff.
something to use. We had people that would come in the pharmacy that would buy blocks of camphor, and they would dissolve it in and you could buy all this in the pharmacy.
Yeah.
They would buy a bottle of piney, Pinee, piney oil.
Yeah.
And they would dissolve the camphor.
Yeah.
In what is essentially turpentine.
Yeah.
And they would make a cough remedy out of it, a homemade cough remedy. And so all that's
I guess it could work, but
if it doesn't.
But it has other side effects, right?
Yeah, people had some crazy stuff. I've even heard of, like the turpentine stuff. That's terrible.
But some of these natural remedies, have you tried these yourself to see how well they work up against some of the patented medications?
Yeah, I've tried some over the years.
Yeah?
Yeah.
And?
I think patent medications work.
Give me a pill, he said.
Yeah.
Right.
Yeah. Now, here's what I tell people as a pharmacist. This is my true advice. If it works for you, then it works.
Okay. Yeah.
And if it doesn't, then it doesn't.
That's right.
So if you go into a herbal medication shop and you take something and it fixes whatever ails you, then guess what? There's no reason to question it. It works.
But that's why it doesn't work for everyone, because everyone's chemistry is different.
Right. Yeah, to a degree.
You know, this could, I think I've been wanting to do a follow-up episode with you.
Mm-hmm.
And I think you mentioned you want to do a little research.
Right.
But man, we have got to, and I'm sure there's a zillion podcasts, 60-minute episodes. You know, I'm sure there's been a dozen articles written on this, but let's do an episode on an expiration dates on medicine. I've been dying to do this with you, Cecil.
That'd be a good one to do. I actually have some examples from like free pharmacies I've run up against, like when we were in Haiti. Like some people would say, hey, send medications down there expired to Haiti because they're not really expired and we can use them. But like the Haitians did not want expired medications. Somebody had taught them how to read all that, and you could not give that stuff out.
Right. Okay. Well,
let's give it away.
Well, let's talk about it. Not now, but let's do an episode. Right. Jot that down in your book there, Cecil.
I'll do that.
He's jotting it down for our next
expiration
episode.
Dates.
Yeah.
The other one thing to do would be pharmaceutical pricing. If you really want to get me started on a soapbox.
Oh man, here we go.
Just because it's very convoluted.
Oh, yeah. Well, but because you hear about people going to Canada to buy their drugs.
Yeah. Yeah.
Why in the world are they doing that?
And why isn't a very straightforward formula for how drugs are priced?
Yeah. No, exactly.
And some of that stuff's been in the news, been very high profile. So anyways, that don't sound right. I guess these days somebody would say that would be a hot take.
It's your hot take on being a pharmacist?
On being a pharmacist.
Now, is this really... Are you also trying to justify for why everyone wants to be an engineer and not a pharmacist because you see it's a dying profession? I'm surprised. I'm just surprised.
Really?
Yeah. I would think.
I'm saying it's not a grand profession.
Yeah.
It's been very good to me.
Yeah.
There's been a lot of great stuff to it.
I would think
I just don't think in 40 years, I don't think it will. Very differently.
But is it different than it was 30 years ago?
Oh, 100%.
Yeah. So, I mean, it's definitely going to change.
And the roles have been changing, but that's what I'm saying is when you've had to change to some degree, the role of pharmacist as much as we've had to change it.
Yeah.
It's almost like we were trying to figure out what our niche was in the healthcare arena. There's something...
Because the writing's on the wall.
Yeah, right. So, I mean, what a physician does may have changed, but the need for a physician and the basics of what a physician does has not changed. And that you go to a physician, he's trained to diagnose you. But what I did as a pharmacist 32 years ago and what I do as a pharmacist now, if I was still in a retail setting, is vastly different.
Yeah.
Vastly different.
Interesting.
Yeah.
Well, I think the same argument could be made for AI and physicians.
Really?
Yeah.
You would want to put your symptoms into an AI generator and see what comes up?
I'm not saying I would want to. I'm just saying that it could happen. We could get to the point where you can really put all the symptoms in there, speak to the AI, and it could figure out what the symptoms are or what possible it is. Now, you wouldn't want that AI linked to WebMD because every answer is you're about to die.
Right. Yeah. I mean, and again, some people are going to say, well, you need the human element in there. But AI, if this week I scared myself with AI.
Oh, really? What'd you do?
I had to do something pretty complicated with those 2 spreadsheets that I had no idea how to do.
Yeah.
And I just typed into AI, said, here's what I need to do with these 2 spreadsheets.
No way.
And it wrote code for me to put into a VBA editor.
Yeah.
And produce the results I needed to produce.
Did it work?
So, yeah, it worked.
Whoa.
But what I'm saying is, I have no idea how to write code for VBA.
Yeah.
And it wrote the code and then it says, here's where you click, here's where you paste and copy, here's what's going to happen, here's how you run it. And it wrote the code.
Wow.
And it did what I wanted it to do.
Now, how were you able to check the answer?
Well, I knew what the answers needed to be.
Okay.
But the spreadsheets were so big.
Right. You had a lot of data.
I had a lot of data. And I could have gone through line by line, but we're talking about 1,000 lines of thing. But this went through and pulled out what I knew what the end answer needed to be, but it pulled it out of 2 separate spreadsheets. And I was like, that's nothing.
That's fantastic.
I mean, what you're talking about, I mean, and again, I think they've limited AI not to do that much yet because I've typed in that kind of stuff before, and they're like, "We are not authorized to give medical advice."
Okay, but we could.
But you can see where that can happen.
Yeah.
But normally you would have to have a intimate knowledge of Excel and how it works,
Right.
in order to produce that result. And I was able to produce it by just asking AI a question.
That's great. I love it.
Yeah. Well, it's a little scary.
Why are you scared? Why
so
is that scary?
then everybody's laughing at me for this. So then after I did that, I asked AI where my pocket knife was.
Yeah?
Because I lost my pocket knife.
Oh, did it find it? Did it find it?
It did not. It gave me some good ideas where to look, though.
All right.
Some ideas I hadn't thought of.
Did you look?
I did.
No dice.
No. But if it had found my pocket knife for me,
that'd have been scary.
All right, man. That's all I got about dissing my own profession.
Hey, man, just hang in there a little bit longer, okay, man? Just hang in there.
I'm at the end of my profession. Yeah, if any new pharmacists are listening to that, what is he?
Hey, before we close, we want to thank everyone for listening. If this is your first time and enjoyed the conversation, would you consider hitting the subscribe button on the platform you listen with? Also, if you're a longtime listener, please give us a rating. Leave us a review so others can easily find us and join the conversation.
All right, That Don't Sound Right is a production of TSR Podcasts in conjunction with Camel City Studios. I am your co-host and sound engineer, Cecil. Peter's your other host and your web designer. Camille does our bartending for coffee, not for, let me restate that.
We call that barista.
Camille is our barista. Emily, bartender. Emily does our graphic design. Ella does our Instagram. Georgia tests our merchandise. Brent is our international brand ambassador. And as always, listener number one is
Scott.
So until next week, keep talking.
And stay curious.